Hi, I'm Christine Taylor. I'm a mama in San Antonio, Texas. I have an 8-year-old boy and an 8-month-old son that I gave birth to in December. I'd like to share my story of a life saving experience with Dr. Vandever. I am so grateful for her and so gracious how I'm able to stand here today just sharing my story. On December 13th, I I went into labor, and in that experience, it wasn't as smooth as I would have liked it to have been. Throughout my whole pregnancy, it was seamless, beautiful, no complications. I didn't have any pre existing conditions. I didn't have any medical history that would lead anyone to believe that I would have any complications. But on the night of December 13th, I started to go into labor, and I was at 39 weeks at the time. And it wasn't like my first delivery experience. And I knew something was different and something seemed to be wrong. I started to have seizures, which is definitely not something that I've ever had or experienced. And I was rushed to the hospital where they had diagnosed me with eclampsia and HELLP syndrome. This was very shocking to me and my family because we didn't have anything that would indicate that would be the case during my pregnancy. I had a very healthy pregnancy, but it happened so quickly. And I don't remember a lot of it. My husband shared the experience with me once I was recovering in ICU. But when we got to the hospital, it was decided that I would need to undergo an emergency C-section, which was performed by Dr. Vandever. And her quick thinking, her diligence, and her care allowed for us to have a beautiful postpartum experience where I was alive, my son was alive, and we were able to recover from that in the hospital beautifully. But I really owe a lot to Dr. Vandever for her, just her quick thinking and her care for me and my son in the moment in that emergency situation. And so I was able to undergo the surgery and deliver the baby. And so I was in ICU recovering for some time while my son was in the NICU. And that experience opened up my eyes to different things about birthing that I wasn't familiar with before when I had my first son. And so when I was recovering, I would visit my son in the NICU. And while I was producing milk, I wasn't producing enough. And I was so grateful that my older sister actually donated her own milk. She had a 6-month-old at the time, and she graciously donated her own milk so that my son Mark could have exclusive breast milk feedings in the NICU. That was something I wasn't aware was possible, but it planted a seed in my heart where even after we left the hospital, I started researching about the opportunities to donate because I was overproducing. I was producing more than Mark was needing. And so I knew that there was a need once I researched this and I found out that the hospital we delivered at goes through a certain organization. And so I registered, I applied to become a registered milk donor, and I was approved. And so in the midst of that entire experience, I was able to take that knowledge that I gained with my time with my son in the NICU and give back by being a milk donor, where the milk is donated to NICU babies. And it's just an amazing full circle of my experience being able to bless other families and their babies. And so in the end, it all started with me being under the care of Dr. Vandever and her really saving my life and saving my son's life. And for me to be able to give back in this way is just an amazing testimony of how everything works out for good. And so I'm just so grateful that I'm here today where I can share this story.